Welcome to Inside 340B Report, an insightful conversation between 340B Report's editorial team on the key issues affecting the 340B drug discount program, the nation's second largest government drug program. Hello, and welcome to the latest episode of Inside 340B Report. I'm Ted Slafsky, publisher and CEO of 340B Report. Today, I'm joined by Shannon Young and Will Newton, who are associate editors and senior writers at 340B Report. Shannon and Will, thanks for being here. How are things going?
Yeah, thanks for having me.
Yep, looking forward to the show, Ted.
Good. It's been dreary weather around here, but hopefully we'll get a nice weekend here in Washington, right, Will?
Yep, that's what we're hoping for.
Good. All right, before we start, first I want to let our listeners know that we are pleased to offer a special 25% discount to 340B Report first-time subscribers. You can go to the subscribe tab at 340breport.com and use the coupon code podcast25 to take advantage of the discount. I know you will find our news service to be a valuable investment. Also, I want to encourage you to check out our brand new podcast, 340B 360, hosted by a longtime colleague of mine, Anna Mangum. 340B 360 showcases the leaders from 340B Report's valued sponsor companies and the crucial role they play in the 340B ecosystem. You can get 340B 360 wherever you get your podcasts. Today, we're going to start by diving into the implications of a major federal court ruling on drugmaker 340B rebate models and what it means for stakeholders. Then we're going to discuss HHS Secretary Robert F. Kennedy Jr.'s first public comments on the 340B program. We also talk about the major Republican reconciliation bill, as well as a new executive order from the president on drug pricing. Finally, we'll close by talking about the Oklahoma governor's decision to veto a contract pharmacy access bill that had easily passed each chamber of the legislature, and the role that dark money groups played in aggressively lobbying for that veto. Will, can you start by telling us about the latest developments in the lawsuits revolving around drug makers' attempts to establish 340B rebate models?
Yeah, for sure. So the rebate saga has been going on for months now, and we finally got our first judicial ruling in this. So it certainly clears some things up, but also there's still a lot of uncertainty, as I'll go into in a minute. But yeah, just to catch everyone up. So as we know, at various points last year, 5 different drug manufacturers, Johnson & Johnson, Eli Lilly, Sanofi, Bristol Myers Squibb, and Novartis, all approached HHS and HRSA, which oversee 340B, and said that they were going to convert upfront 340B discounts to a post-purchase rebate for some or all of their products. HHS and HRSA responded by saying, the 340B statute says you can't implement a rebate without agency approval. And these drug manufacturers all sued the government's position in court right after that. So it's important also to note here that for most of them, the government, HHS, said, we have not approved your rebate model at this time. So not outwardly rejecting it, but also not approving it. The case of Sanofi was a little different in that the government said specifically because of the unique way Sanofi's rebate model, which they call the credit model, was set up, the government said that that actually would violate the 340B statute, and they outright rejected that one. So anyway, all of these court cases have been going on, and at the urging of a federal judge after oral arguments, HHS recently announced at the very beginning of May that within 30 days, it expects to be in a position to provide guidance on rebates. So that sort of sets the table for where we are. So a very important court ruling happened in 4 of those cases. So the cases related to Eli Lilly, Sanofi, Bristol Myers Squibb, and Novartis, as well as the drug industry vendor Calderos. And the judge basically ruled in favor of HHS and said that the agency has the authority to pre-approve any rebate models. So what's pretty important about this is that the judge didn't say that a rebate model could never happen. The judge just said that a drug maker can't unilaterally decide they're going to implement a model. They have to get agency approval first. So 340B Health, which is a big hospital trade group that was intervening in the case on the side of the government, they had asked the judge to basically declare that any rebates are prohibited under the 340B statute. The judge did not do that, but the judge said, HHS has to approve them. The other sort of nuance in this court decision was related to Sanofi, which, as I said earlier, was the only one where the government had actually outright rejected the rebate model. The judge basically just sent that back to HHS and said, look, you need to reconsider Sanofi's rebate model. And if you're going to reject it, provide more clear reasons for why you're doing so. Doesn't mean Sanofi can, implement a rebate. It just means that the government has to reconsider it. So it's a pretty big, complex decision with a lot of moving pieces. But really, the main takeaway, I think, from my reporting is that this guidance HHS is about to come out with just got even more important, because now a federal court has confirmed that HHS has the authority to decide whether or not there can be rebate models. And the agency now, at the end of this month or early June, is going to actually put forth some guidance that presumably could, outline and specify in what cases or under what scenarios, if any, there could be a rebate model. So definitely all stakeholders are very much looking forward to that. And when speaking to a lot of the people in the 340B community among providers, they were all pretty happy that the court upheld HHS's authority to decide. But also they were saying that they would like HHS to take a firm stance against drug maker rebates. And they noted various issues with the model that they say would harm their ability to care for patients. The drug industry, on the other hand, they expressed disappointment with the decision. They did point to some aspects where the judge said that they had, quote, valid concerns about the program and the fact that the judge didn't categorically prohibit rebates. So, it was more of a mixed bag for them. But I think certainly if you're in the drug industry, even though you lost in the sense that you didn't get the outcome you wanted in court, as a result of all of this litigation, rebates have become a big topic, and HHS is now going to issue guidance on this thing, which would have been, unheard of a year before. So certainly there are some things that the drug industry, I'm sure, is happy about with this decision coming up. And then I guess the final thing to sort of say about this is that there is one separate case involving Johnson & Johnson, which is before a different federal district judge than the other 5 cases. So there hasn't been any hearing or ruling or anything on that case yet. Although 340B Health, the major hospital trade group that did intervene in this case, is now also intervening in that case. So that's certainly something for us all to watch as well.
Yeah, and I think it's important that 340B Health was allowed by the judge and the judges in both of these cases to be approved as an intervener, because, as you know, Will and Shannon, being an intervener gives them significant more power and ability to play a role in the actual court case, from everything from arguing before the judge, submitting various motions to the judge, and also having the ability, if the judge comes up with a decision that is concerning, they have the ability to appeal a decision that might not go their way. So I think the healthcare provider world is very happy that a trade group that is an advocate for the 340B providers is part of the various suits. And I think that will be critically important coming down the pike, particularly with an administration that appears to be more friendly, despite their rhetoric against the drug industry, appears to be more friendly and sympathetic to their cause than previous administrations, or at least more sympathetic to their cause than the Biden administration. So before we continue, let's take a moment to hear from one of our great sponsors.
eliminate double payments, ensure compliance, and achieve unparalleled transparency with RX Paradigm's 340B Clearinghouse. Powered by the Tungsten Plus platform, RX Paradigm aligns seamlessly with stakeholders' needs, enabling covered entities to deliver cost-effective care while preventing double payments from drug manufacturers. With RX Paradigm's collaborative 340B clearinghouse approach, double payment concerns no longer justify network restrictions. Unlock a streamlined, balanced 340B management solution for all parties, and discover efficient, optimized 340B management today with Tungsten Plus.
It's unclear what HHS guidance we're actually going to get about rebates, but we've gotten some indications of where the department might stand on the 340B rebate matter based on some recent comments from HHS Secretary RFK Jr. I know that RFK Jr. didn't specifically talk about rebates, but he did talk about the 340B's program's impact on the drug industry. So Shannon, can you tell us more about that?
Yeah, so after all these weeks of waiting to see where RFK Jr. falls on 340B, we got a little bit of insight in the past week or so. On May 14th, Kennedy provided his first public comments on 340B during an appearance before a House Appropriations Subcommittee. He was there testifying on President Donald Trump's 2026 budget proposal, which, if you remember, contained a few details about the administration's planned reorganization of HHS, but it didn't really provide specifics on some of the rumored plans we're hearing about moving 340B from the Health Resources and Services Administration to the Centers for Medicaid and Medicare Services. So lawmakers asked about the reorganization, specifically Representative Chuck Fleischman, who is a Tennessee Republican. He described himself as a strong supporter of 340B and asked Kennedy if he could confirm or deny the reports that the department will move oversight of the program from HRSA to CMS. Kennedy declined to comment directly on that, citing a court order over the reorganization plan. But he did mention the 340B program's growth and argued that patients, quote, seldom get the benefits of the drug reduction, talking points that are often cited by the drug industry. He also noted the important role that 340B plays for rural hospitals and highlighted how the drug industry is raising concerns about a drug pricing executive order and how that could be related to 340B. So I'm going to just read a little bit of his exact comments here. Specifically, he said the 340B program, as you know, is not a straightforward program because it was originally intended for 100 institutions that were serving very poor communities. It's now grown to 27,000 institutions. The patients themselves seldom get the benefits of the drug reduction, and actually 100,000 if you look at the kind of satellite institutions. But we also recognize that it is the lifeblood of rural hospitals right now, so we can't mess with the program without giving those rural hospitals something else that is going to support them, and we understand that. And then he finished up by saying, I can tell you that the drug companies are worried because if we do what President Trump wants, which is compliance with the executive order to go to most favored nation, it will lower the price of all drugs, which means it will further lower the cost of 340B drugs. And they consider that existential. So that is a problem that we all need to work out together. So Kennedy also later reiterated the important role 340B plays for rural hospitals at a May 20th Senate subcommittee hearing. But he also said the program is, quote, very controversial and is now under litigation. His remarks there were a lot more pared down, and it was almost a blink and you'll miss it type moment, but again, offered a little bit of insight as to, how the agency might be looking at this program. And his remarks drew mixed responses from the 340B stakeholder community, as expected. A lot of advocates, offered mixed response. Some didn't want to directly come out and criticize the secretary. Others were more candid. And some, noted how similar some of his talking points are to things being circulated by the drug industry. And so we're still sort of in a wait and see on more details here, but that is sort of our first inkling into the ongoing at HHS on 340B.
Shannon, you're really right that RFK Jr.'s remarks largely reflected the talking points of the drug industry. So it looks like Secretary Kennedy has been drinking some of the pharma Kool-Aid, especially when it comes to the supposed growth of the 340B program. The figure of 100,000 satellite facilities doesn't make any sense to me. I mean, there was a change in the way hospitals and other entities had to list the facilities that get access to 340B pricing or potentially could prescribe a 340B drug, where basically about 10 years ago, hospitals started to have to list basically every medical department for every specialty in the hospital or at the clinic that where a doctor might prescribe a drug. So rheumatology, endocrinology, everything, or the orthopedic office, whatever type of office it is, it's now listed. But it really doesn't mean that's really a reflection of where the drugs are going. There may be a prescription written by the doctor there or the nurse practitioner, but it's really the providers would argue that that's a gross exaggeration of the size of the program. And I'm sure the providers I could say they have their work cut out for them. Clearly, the drug industry has gotten more access to the RFK Jr. And the administration than the hospitals and other providers. I did notice that there have been other hearings over the years where the HHS secretary has been asked more questions about 340B, and most notably, just more recently, Secretary Becerra, who was President Biden's HHS secretary, was asked some questions about 340B from both skeptics of the program and champions of the program on Capitol Hill. And he underscored how important the 340B program is, not just to rural hospitals, but to all covered entities. So this is going to be a much tougher administration to work with. The previous Trump administration was not a fan of this program. And thanks to the support of folks like Senator Thune, most of those most draconian efforts never became law, but it was certainly a challenging time. And we all might recall the big Medicare Part B cuts to 340B hospitals that the hospitals were able to successfully get the U.S. Supreme Court to overturn, but that took over 4 years. So, Shannon, I'm sure the providers in the program are a little nervous today.
Yeah, I'm sure that they are.
Right. So great. Well, I think you're gonna talk now about what else is going on. I know there was a big reconciliation vote just today.
Yeah, so I think part of the reason we're not getting as much of focus on 340B or very specific health programs right now is because the debate over Medicaid is taking up a ton of air in Washington. It's a very hot button issue. It's controversial for both Democrats and Republicans. And with midterm elections coming up, it's going to be an issue that could haunt lawmakers regarding, however they end up voting on this. And so early Thursday morning, the House passed its version of the reconciliation budget on a very tight party line vote. It was about 215 to 214, with Republicans just getting it over the finish line. That bill contains major overhauls to the Medicaid program. And I'm not going to get into all of them right now. We've discussed them on a previous episode. But with everything so in flux right now, by the time this airs, who knows, we could have a whole new rewrite from the Senate. And so just the highlight here, though, is that any major changes to the Medicaid program, any big cuts, those are going to have ripple effects on the 340B program and the stakeholders that partake in it, particularly providers and hospitals. And so we're going to keep our eye on this bill, see what happens, and continue reporting on any developments there, especially as it relates to 340B. So keep an eye on our website in the coming days and weeks. And I believe the goal is still for the Senate to move the bill by July 4th. So we shall see.
Yeah, thanks, Shannon. You're right. These Medicaid cuts are basically a double whammy. You've got the Medicaid cuts that are quite dramatic and will affect all the healthcare providers in the 340B program. And then we're hearing about changes to the 340B program that would reduce the scope and reduce the discounts available. That is really quite scary for the 340B provider community. Outside of the major reconciliation bill, I know President Trump recently announced another executive order related to drug pricing. You already discussed in a previous podcast episode the first executive order that was specifically related to 340B. Can you tell us more about this new executive action?
Yeah. So, as I mentioned in talking about the HHS secretary's comments, because he did reference this on 340B, but on May 12th, President Trump directed his administration to use its trade, regulatory, and enforcement powers to establish a quote, most favored nation model for prescription drugs. And so that would basically bring the prices that the US pays for medications in line with those paid by other developed nations. This has been an issue that we've heard talked about in Washington for a while now. Republicans have supported it. Democrats have supported it in different iterations, different versions. But what is noteworthy is that the executive order kind of lacks some teeth here. The president doesn't have a ton of enforcement power. And so a lot of it is just sort of compelling drug makers to play ball here. And that is going to be a big if. But, some of the details here is that the executive order calls for drug makers to privately negotiate lower prices with the federal government. And it threatens, quote, aggressive action if they fail to offer American consumers the most favored nation lowest price. And on May 20th, HHS announced its specific targets that pharmaceutical drug manufacturers would have to meet to satisfy the requirements of the EO. And so they have to commit to aligning U.S. pricing for all brand products across all markets that don't currently have generic or biosimilar competition with the lowest price of set for economic peer countries. And they get into a little bit of details about, what countries are included in that list. And so we'll see. Some Republicans and Democrats, even on hearings this past week, talked about how they plan to introduce their own versions of legislation that would similarly try to align U.S. drug prices with those paid in other countries. So there is a little bit of appetite in Congress to have this debate, but whether the Republican-controlled House and Senate as a whole plan to actually move on it is unlikely, especially with the drug industry expected to have a lot of pushback to it. So, it's another one of those things where, hope springs eternal, I think, from the White House, but we shall see what happens on Capitol Hill.
Yeah, it's probably not an appropriate time to make a joke about a bridge in Brooklyn, but I do think that I think we are going to sell you a very, very nice bridge somewhere if the Republicans in the Congress agree to a most favored nation policy. No, I don't think that's going to happen. There will be a few symbolic victories, but I don't think anything dramatic is going to change that would require not only an act of Congress, but it would also require other countries to just suddenly agree to higher prices on their drugs. Do they want to get higher prices for their pharmaceuticals? I don't think so. And some of those contracts are long-term contracts. So I am pretty skeptical that this ambitious approach will ever become reality. So with that, I think we will move on to another development that just occurred this week. Tell us about what happened in Oklahoma, Will. I know there's been a lot of attention, and another area of consternation, at least for the providers, are quite upset about what happened, as well as some important Oklahoma Republican lawmakers who feel like they got stiffed by their own governor.
Yeah, definitely. So, as we've covered many times in this podcast, there are now 14 different states that have enacted laws that would prohibit drug manufacturers from placing 340B contract pharmacy restrictions in those states. Dozens of others have introduced similar legislation this year. And in Oklahoma, it very much looked like, they were going to be following the footsteps of their close neighbors in Arkansas or Louisiana or Kansas, and were well on their way to enacting a similar statute themselves. So a 340B contract pharmacy access bill had passed the Oklahoma House by an 83-8 margin, and it had passed the Oklahoma Senate by a 40-5 margin. There's Republican supermajorities in both, and Oklahoma's governor is Republican. So it very much looked like this was on its way to becoming law. Then things really changed, due in part to this pretty aggressive lobbying push by some dark money groups. So in Oklahoma, there had been several ads running while the legislature was considering the bill that really sort of stepped up when it was at the governor's desk. These ads were basically accusing the 340B program of being tied to illegal immigration, of being tied to gender transition surgeries, and of being the subject of waste, fraud, and abuse in the federal government. And they were running all of these ads, basically encouraging the Oklahoma governor to veto the bill and saying that, if he didn't veto the bill, he would be going against Trump, who these ads were claiming wanted to fix 340B himself. So despite this bill really overwhelmingly passing both chambers of the legislature, Governor Stitt vetoed the bill on this past Saturday. And in a quick announcement explaining his decision, the governor's office basically said that he did not feel that the legislature should be picking winners or losers, and that the 340B program should be reformed on the federal level. Well, the lawmakers pretty strongly criticized that decision. They were basically saying, look, we passed this with huge supermajorities, and this is a bill that is designed to help, our most vulnerable patients. And they also spent a lot of time highlighting the impact it has on rural patients. They also accused the drug industry of being behind the ads and of getting these dark money groups to basically sow discontent with this bill that otherwise had pretty wide support. They're also calling right now to have, to get the numbers to overturn the veto. So from, hearing from one of the lawmakers behind the bill, a senator in Oklahoma, basically said this week, both chambers are pretty tied up with budget and appropriations debates, but next week, which will be the week this podcast comes out, there is some hope that lawmakers will at least consider whether or not they're going to override that veto. And this is important because Oklahoma's legislative session ends on May 30th. So there's not too much time there. So this is also pretty notable because this sort of playbook and this group in particular, Building America's Future, which is a 501c4 nonprofit advocacy group, it's not required by law to disclose its donors and doesn't, has been running ads like this in a lot of states. And it's had pretty mixed success. I would say many of the states that it's run ads in this year, including Nebraska, Utah, North Dakota, South Dakota, have enacted laws despite the ads. Many of us remember, though, last year when a Virginia bill had easily cleared both chambers, the governor rejected it and echoed some of the talking points that Building America's Future's ad had been making about the bill. So they've been a major player in these state debates, and I would expect them to continue to be. So it's really interesting to follow this. And then the final really quick update to keep all of our listeners aware of on the state level is, there's so many different states that have introduced bills or, had bills clear a chamber or clear a committee. But in Colorado and Hawaii, there are two bills in particular that combine both contract pharmacy protections and then some reporting requirements for covered entities that have passed both state legislative chambers and are awaiting action from their governors. So we're certainly expecting to hear some movement there and some news there. I would expect both of those are going to become law. I don't think there has been the pushback in those states or any dark money interest in those states the way there has been in some of the more Republican states that have also been considering these bills. And then also in Vermont, we should be hearing some news soon there as well. And what happened in Vermont, pretty similar to Colorado and Hawaii, is that it looks like potentially reporting requirements are going to get matched with contract pharmacy protections. So the Vermont House passed a bill that was just contract pharmacy protections. Then the Senate passed the bill, but amended it. So it added some reporting requirements. And now it's back to the House. And, are expected to debate this amendment and decide whether or not they're going to, move forward with their own version and reject the Senate's or accept the Senate's or try and negotiate somewhere there. So that's another state bill that's very far along, and we expect to see some movement there. So lots to be following, and I'm sure you'll continue to be getting, if you're one of our subscribers, lots of news alerts in your inbox in the coming weeks about state action, because there's still a lot on the table.
That's right, Will. And let me guess, you're going to ask that you get to go to Hawaii to cover the bill, the governor's bill signature.
Yeah, I think it would be a really good opportunity to get some good quotes and develop some sources. So
yeah, Ted, I think he might need some help too. So I can go.
Right, Shannon. Both of you could go and do some from the field reporting, right?
Yeah.
Okay, as long as I get to go with you, maybe we should do that. Well, if we weren't such a small, tight budget, just trying to survive, I would actually be on a plane with all three of you. But maybe one day, if we can get more subscribers to subscribe, we have a great deal going on. Speaking of that, take advantage of our 25% discount by going to 340breport.com and clicking the subscribe button, and use the discount code podcast25. That's podcast25 at 340breport.com to help us on our important trip to Hawaii. No, actually, we wouldn't do that. We're very good stewards of your investments, and we would unfortunately watch the ceremony from our laptop. But maybe, you never know. Maybe one day there can be a 340B Report conference or meeting in the beautiful state. So with that, I'm going to go ahead and wrap it up for today. We will be back in 2 weeks for our next podcast. In the meantime, as I mentioned, please listen to 340B 360. Please follow the news at 340breport.com. And we look forward to continuing to report on the latest developments. Thank you, Will.
Thanks so much, Ted.
And thank you, Shannon.
Yeah, thank you.